Hi everyone, good afternoon. Sorry, we had some tech glitch, which is why we are starting like 5 minutes later. I would just dive into the discussion. My name is Goodness Ode. We are so glad to have you. Thank you so much for introducing yourself. I can see your amazing introductions and where you're joining us from all over the world. Tomorrow being the 20th of February, across the world, the United Nations and several bodies will be commemorating the World Social Justice Day. And for us at ICFP Power Shifting Subcommittee, we would love to get everyone involved in this discussion in your respective field and the work that you do. And through this webinar, we hope that we are able to really understand why is SRHR a social justice issue and what does that mean for inclusion and for addressing the systemic barriers and pushback that we're currently experiencing in the field of sexual and reproductive health and rights. Just before I dive in, I would like to quickly share my positionality on this subject. Um, I am a Nigerian. I'm also the first of a family of six. I am a twin, and I have a bachelor's degree in public health and also an MSc in health policy planning and financing from the University of London, LSE and LSHTM. As a result of my educational background, I come from a low-class family, and my educational pursuits, academic and professional, has been a mix of social justice movements that has culminated to who I am today. My access to education, my access to being able to be in this space to speak to you all, the professional development opportunities I've also accessed, and also the barriers that have also been faced in terms of accessing sexual and reproductive health information services. And this is not peculiar to me, but many more girls and women like myself in my country, Nigeria, and many other marginalized communities. So, given the context of this privilege that I hold, being in this space, we would love that we all engage. We hope that this will be a shared learning platform where we are able to learn from each other in that regard. I will be handing over to my colleague, Amarachi, who would be taking us through the tech check for the call. Thank you.
Hi, Goodness. Thank you. I will share my screen now so that there is French and Spanish interpretation for this call, and I'll be sharing my screen so that you can see the globe feature just below, and you can be able to access the interpretation. Okay, great. So just like this slide shows, you will see the arrow pointing to the interpretation globe sign. Once you click on it, you choose your preferred language, and you'll be able to hear the interpretation in real time. So Goodness, over to you.
Okay, thank you, Amarachi. So I would be inviting one of our distinguished speakers who would be giving us some more insight to what the discussion for today is all about. Before I call her up, I'd like to briefly read her bio. Her name is Clara Maliwa. Clara Maliwa is a dedicated gender equality and disability inclusion advocate. She's committed to advancing social justice through inclusive development and human rights-based approaches. Clara has contributed to gender and social inclusion initiatives with the UNDP Tanzania, where her work has supported efforts to strengthen inclusive policies, community engagement, and equitable participation in developmental process. She's recognized for her dedication to intersectional advocacy, strategic collaboration, and fostering inclusive spaces for meaningful participation. Clara, we're so glad to have you on today's call. Over.
Thank you so much, Goodness, for inviting me to join this important conversation. Hi, everyone. As introduced by Goodness, my name is Clara Maliwa. Greetings from East Africa, Tanzania. And I'm happy to be joining you all. And I'm also as well looking forward to learning from you. Please allow to switch off my camera. I hope you are all able to see me. I'm waving from this side. I have extreme low vision,
Yes,
so
we can see
sometimes,
you. Thank you.
yeah, so sometimes I get too close to my computer, so sometimes you might be able seeing the air. So please allow me to put off my camera, then we continue the conversation. Thank you. So to me, when we speak on social justice, First, I will say social justice begins when we recognize each other as a full human beings. What does that mean? When dignity, rights, and protection are denied, that's social injustice. I'll share you a little example from my country. Around the world, people with albinism freely take part in their society. They are respected as full human beings. Dignity, rights, dream, they are protected under the laws. Unfortunately, in Tanzania, which is my country, this reality is still revolving. Yes, we do have the laws. We have strong legal commitments to protect people with disability and promote inclusion. Yet, social justice asks a deeper question. Do our system, attitude, institutions consistently reflect those commitments in practice? That's a question, like, I don't have an answer to that. When I was young, people with disability, particularly those with albinism, like myself, faced a very deep stigma, discrimination, and violence. We were not seen as normal human beings. We were not considered as any other human beings. We were linked to myths and rituals that costed most lives and our social freedom. Our body parts were associated with wealth, power gaining, mineral dictators, and a lot more, bringing good luck and all of that. In short, we were dehumanized. According to the BBC report, in 2017 alone, nearly 80 people with albinism were killed in Tanzania. Their body parts trafficked because of the beliefs, as I mentioned above. So what is that? That is not culture. That is not social. That is social injustice. So, social injustice begins the moment we start seeing each other as incomplete human beings. I came into this space not only as a gender specialist with UNDP Tanzania, but as a woman with albinism, a woman with disability, a mother, and someone whose life has been shaped by exclusion, poverty, violence, and resilience. So when I'm speaking about social justice today, I'm not speaking from theory. I am speaking from survival. Growing up as a child with albinism, I was not only just poor, I was structurally excluded. No sunscreen, no protection, no understanding of what albinism is. I walked under the sun rays for hours. I was mocked. I was bullied. I was denied dignity just because of my skin color. In short, I was dehumanized. This was not cruelty. Was not just cruelty. It was disability injustice. It was poverty. It was lack of social protection. It was lack of accurate information that people needed to understand what albinism is. How does it occur and all of that. All through that, education became my only exit strategy. Remember, when you have albinism, it's automatically associated with low vision, extremely low vision. So by then I couldn't read on the board. I couldn't read the small fonts in the books, but I listened attentively. I had friends who read for me, and thanks to God, I passed the exams. That's when I learned something very powerful, that the systems are not designed for everyone, but people survive anyway. Here's the big question to all of us. Why should survival be a standard? Why? Looking at SRHR, Sexual Reproductive Health and Rights, To me, SRH is not an option. It's a social justice. It's about power over bodies. Who control bodies? Who decides if you access care? Who decides if you receive contraception, safe pregnancy, or even dignity? Social injustice reveals itself very clearly in SRHR. Again, I will share with you a brief story of mine. I was once pregnant with twins. When I was with that pregnancy, I experienced that injustice personally at 22 weeks of that pregnancy. I lost my twins because service provider delayed care. Instead of urgency, there was judgment. Instead of compassion, there was blame. Nurses asked themselves, who impregnated me? Questioning the father, blaming him for having sex with a person like me. Questioning how the children will look like. Questioning why I didn't feel pity for myself, that I should have practiced sex. Meanwhile, while they are busy arguing, I was losing my babies. And yes, I delivered them at 22 weeks. They died in my hands. That was not just a personal tragedy. That was reproductive injustice. When health system judges instead of care, that is social injustice. When disability shapes how you are being treated in maternity wards or in labor rooms, that is social injustice. When stigma delays life-saving services, that's also a social injustice. In short, I can say inequalities always shapes health outcomes. And marginalized groups like women, people with disabilities, rural communities, and other vulnerable groups always experience higher maternal mortality, higher unmet needs for family planning, and more violence compared to other groups. Without social justice, you cannot fully enjoy SRHR. You cannot enjoy education. You cannot enjoy employment, neither participation in the society. In the United Nations, social justice is defined as the fair and compassionate distribution of opportunities, resources, and protection in the society. In simple terms, I can say your life chances should not be determined by gender, disability, poverty, race, or where you're coming from, where you were born. But my life shows the opposite. My disability meant danger. Pregnant meant labor, meant loss. Poverty meant labor. Being a woman meant vulnerability. That's social injustice. At UNDP, we see social justice not as a charity, but as a system change. It means inclusive policies, social protection. It means gender equality, disability inclusion, and governance that protects the dignities. We see SRHR not only as a health issue, but a developmental issue, a governance issue, and an economic issue. If then SRHR is not funded, protected, and decolonized, the social justice means only a slogan. Social justice is not about saving people like me. It's about dismantling the system that makes suffering normal. It's about designing systems that are seeing every human being as a complete. It's about ensuring that no child, regardless of her ability, is killed because of myth or perception. No woman loses her pregnancy because of stigma, discrimination, or judgment. No person with disability is treated as less than a human. If we truly believe in development, then we must invest in inclusive health systems. We must fund SRHR. We must end stigma, protect those with disability, and build institutions that saves the most excluded first. Because justice, social justice, begins the moment we recognize each other as full human beings. And until that recognition becomes reality, our work is not done. Thank you so much, and I'm returning the mic to you, Goodness. Thank you.
Thank you. Thank you so much, Clara, for setting the stage and giving us a powerful reminder of why we are celebrating the World Day of Social Justice. Such powerful words, and we'll definitely reflect on that even during this session and even as we celebrate the World Day of Social Justice too. Good morning, good afternoon, good evening, everyone. I hope you're all doing well. My name is Cinnamon Nyagaka. I'm a medical doctor from Kenya and a youth advocate volunteering for an organization called Respect, which stands for Reproductive and Sexual Health Program for Kenyan teenagers. And we work at the intersection of global health, equity, and community-led change. My work has largely focused on sexual and reproductive health and rights, particularly supporting young people in marginalized communities to move from being program beneficiaries to decision makers in the systems that affect them. I come into this conversation both as a clinician who sees how policy translates into real patient outcomes, and as a youth advocate from the global south who has experienced and worked to challenge the power imbalances that shape global health spaces. So today I am not moderating as a neutral observer, but as someone who's deeply invested in the question we're discussing, the sense of who holds power in health, whose knowledge counts, and what justice actually looks like in practice. I'm really honored to hold space for this conversation with our panelists and all of you joining us today. So I'm really honored to be joined by three incredible advocates whose work spans community, policy, and global movement building. First, we have Nomteka Mjwana, who leads the Human Rights and Gender Justice Priority at Frontline AIDS. Her work focuses on removing human rights barriers in HIV programming through community-led advocacy, participatory research, and policy change across local and global spaces. Nomteka, welcome. We are also joined by Amaranta Gomez Regalado, a Zapotec indigenous activist, social anthropologist, and seasoned advocate working across health, sexuality, human rights, and cultural promotion. Her work centers ancestral gender identities, trans rights, and community knowledge in shaping policy and research. Amaranta, bienvenida. And finally, we have Naike Ledan, cross-sector lead at ILGA World, where she works to strengthen collaboration across LGBTQIA+, feminist, and SRHR movements, helping build shared strategies and collective power across regions. Naika, we are grateful to have you. I want to start with what I think is the core question of our conversation today. To my three panelists, in your work and advocacy, do you see SRHR as a social justice issue? And if so, what makes it a matter of justice rather than simply a health issue? And as you answer, I'd love for you to share your positionality and how your perspective, experience, or role shapes the way you see these issues. So we'll begin with Nomteka. The floor is yours.
Thank you very much, Cinnamon, and I love your name. And greetings to all of you colleagues. Thank you so much for joining the session today. My name is Nomteka Mjwana, as introduced. I think the two ways in which I'll answer the question on how I came to do this work really defines my positionality. I am a South African Black woman. I come from a family of service. My mother was a nurse, my dad was a police officer. I've got teachers, I've got everyone. And still, in that same light, I have seen as a person growing up in a small township in Johannesburg, various ways in which reproductive health, understanding of identities, bodies, autonomy evolves, shifts, and really is grounded within that space. I then went to study, as most of us would when we are trying to escape the worst of capitalism, and I worked as a peer educator voluntarily while I was pursuing a qualification as a communications and public relations professional. And all of that cascaded into me really settling in my own version of service as a human rights advocate across reproductive justice, primarily at national level on abortion access and contraception, but then really worked a lot regionally and globally as well on HIV advocacy, as well as sexual and reproductive health and rights. I do want to start with the SRHR as a social justice issue by prefacing as well that I am a mother to a 6-year-old, a mother by choice, a mother who had options and resources to support those options. And in my experience and understanding of what obstetric violence could look like, I also opted to have a home birth. And that too was well enough resourced for it to be a fair and informed process. And all of these things are currently sitting as privileges when in fact they are a fundamental and very foundational human rights. Because we've got limited time, I think the question of SRHR being a justice issue, a social justice issue, really, I will summarize it by paraphrasing most of what comes from Mama Loretta Ross and the leaders of the reproductive justice movement, which defines reproductive justice now not only as an issue of securing rights and bodily autonomy, but one where the social, economic, and political conditions are in place for every single person to make and act on decisions about their bodies, about their families, about their lives, without any harm or any negative structural impact. It's fair to say that we are seeing a lot of progress that had been made in that, but in this climate, we are also seeing a lot of redress across communities and populations. And so it is very important that we continue to emphasize the importance of social justice issues being cross-cutting across economies, thriving communities, health, but that informing really bigger ways in which we thrive. Thank you. I will park here.
Thank you, Namtika. We'll move on to Amaranta. The floor is yours.
Hola, ¿qué tal? Buenas tardes.
Hello, everyone. Thank you so much for this invitation and for this question. I would like to echo what Clara mentioned at the very beginning regarding how to share systems. And I would like to say that I am an indigenous person from Zapotec, from the south of Mexico. I am an activist, but also I am an anthropologist. And these two dimensions in my life have allowed me to notice several situations that condition the fact that our citizenship in full as citizens of a country or of a community to be actually exercised in full. And how is it that a full citizenship should be a fundamental element for social justice to be a reality? Furthermore, I would like to say that having been born in an indigenous community, there is a system that we are still dragging, which is colonialism. Colonialism and post-colonialisms that are modern now, but have been camouflaged currently, do not allow for indigenous communities to be acknowledged as subjects of rights. And I would like to mention as well that my activism starts from realizing how the HIV/AIDS epidemic some 30 years ago was started to happen at the interior of our indigenous communities. Sometimes I was thinking that we were late to the access of health for this type of situation, but I suddenly realized that one that was late, the Mexican state, to provide this type of service to indigenous communities. However, I think that the autonomy of indigenous communities is also a very important element to walk towards social justice. I agree fully with Namtika that when she says that it is not only about the body autonomy, we need to go beyond that. How can we make it so that people have access to preventative care in their own language, in their own identity? And it has been demonstrated that this is possible. During COVID, there were indigenous language campaigns that worked very well. So this is something that we can do so that indigenous young people can have access to preventive contraception methods and also to health and timely health services with a cultural element. Another very important thing that I have learned from HIV throughout these years is that racism and classism are still two fundamental elements that we need to continue fighting. This is something that we are still dragging on, which is an epidemiological racism. Currently in Latin America, if you ask what is the percentage of people living with HIV inside indigenous communities, very few countries have actually incorporated that as part of their data. So the lack of data in many cases does not allow for our populations to actually be perceived as prioritary. So I think that we need to build a global strategy that allows for those cultural devices that are long term, like the colonial thinking heritage and this type of racisms, classisms, and discriminations can be broken up. And therefore, to place women, young people, and teenagers at the center of the debate so that they can have access to early services. And I will wrap up saying that in the world of indigenous communities, there is not only this binary situation, there is also not only the sexual binarism, but there are also ancestral sexual heritage that would be a very interesting topic to address later on. Thank you.
Thank you so much, Amaranta, for sharing your positionality and also your thoughts on why you think sexual reproductive health and rights is a social justice issue. I'll move on to Naike. Floor is yours.
Hello, everyone. Thank you. On my part, adding to what my other colleagues here have added, I would say, well, one thing is that I was raised in Haiti. It's an wonderful, wonderful island that is also very wrongly represented, and that has a huge colonial and post-colonial legacy. I will spare you the history, but it is, let's say, one of the countries where whether you come from a rural area, whether you're dark skin, black, white passing, whether you're living with disability, all the different ways in which you navigate life and you navigate your identity, whether you're a trans woman, your access to any sort of access is determined by the compounded effect on how the society includes you or not. And that is in your community, in your own family, yet deeply linked in historical colonial oppression that we've inherited and we started regurgitating in our own social lives. So for me, SRHR, just like healthcare or education, is totally affected by those different identities that determines whose life matters and whose life doesn't matter that much. Because access to SRHR is deeply shaped by income, by race, by gender norms, legal status, and political climate. So when we talk about SRHR, we talk about who gets to live safely, who gets to participate in economic and political life, and who is considered legitimate and who is considered illegitimate. So it is not just about health services. It's about control. It's a control over people's bodies, their future, their participation in society. So when somebody cannot decide if or when to have children because they're queer, or because they're living with a disability, or they're perceived to not have agency or mental capacity to make decisions over their life based on social biases. You can't access gender affirming care, for example, because you're perceived as deviant for your identity or being trans or gender expensive. Or you face violence, right, because of your identity. It is not a medical issue. It is about power, dignity, and structural inequality. So I will stop here. I'll keep it brief because it's just adding to what my colleagues have said. Thank you.
Thank you so much, Naik. And thank you all of you for grounding us in why SRHR is a justice issue. I want us now to move from why to how injustice actually shows up in systems, policies, and lived experiences. Because inequality isn't abstract, it's experienced differently depending on who you are, where you live, and how institutions see you. Nomtik, I'll start with you in 1 to 2 minutes. From the HIV response, we have learned that health outcomes are rarely just biomedical. They're shaped by law, stigma, and power. How does frontline aids approach the intersection of HIV, gender justice, and human rights in your programming? And what changes when programs are designed through that lens? So I'll give you 1 minute to respond.
Thank you very much. I will try to be very quick and just really summarize what our overarching objective and our human rights priority is. And we do work that responds, right? A lot of the pushback on reproductive justice and gender justice is really now currently something that's happening in a rampant manner. And so we have an emergency response granting mechanism that's currently being iterated to really look at even considerably strengthening health mechanisms. So we've got the Rapid Response Fund, which really looks at supporting communities. Sorry, the time chase is making me stutter. Supporting communities in responding to emerging immediate human rights threats and violations. This has been particularly to LGBTQ+ organizations working in HIV and human rights, but also in the most recent iteration that just ran out, we included some organizations and communities, including sex workers. And the Rapid Response Fund really is where partners get to be resourced to be able to immediately, either get to safety, legal action, and all kinds of immediate response mechanisms to prevent the actual ongoing violence. And then in extension to that, we then have REACT, which is a human rights monitoring mechanism that is implemented across the countries. And this is where partners document and respond to the violations at an individual basis with people in the community. And most of that evidence is securely stored in a system that partners use and access to develop evidence for advocacy at national, regional, and global level, which then cascades to the third bigger area of our work, and that is policy advocacy, actively supporting partners across that national level, but big engagements with human rights mechanisms regionally and globally as well. And then there's a bigger piece around our convening and learning space where that's concerned, where we coordinating narrative change work. So aligning with messaging for partners, developing resources that really counter the disinformation. So frameworks on comprehensive sexuality education, HIV disinformation, and then ongoing technical guidance and expertise, particularly on gender and SRHR. And I'm sure most of us here who are familiar with my colleague Yumna, there's quite a lot of work as well that she's driven, and the discourse around HIV as a feminist issue, but also a lot of technical inputs within the partnership and with partners around key SRHR spaces. And so there's that facilitating of learning, but because we're a global partner and organization, it's really that convening space to be able to respond to these violations, monitor and channel this to address the bigger systemic barriers across working areas. I hope that was sufficient.
Okay, it's okay. Thank you so much for sharing what Frontline Aids have been up to, and it's amazing the work that you're able to do and through the programming, what the impact you're trying to create. We'll move on to Naike. Naike, from ILDA global work across regions, what patterns of discrimination are you seeing repeat themselves across countries, and what does that tell us about the nature of the problem?
Sure, Cinnamon. So at ILGA, I lead the cross-sector piece, but I also coordinate on the different ILGA regions. So we do have ILGA Asia, ILGA LAC, ILGA Oceania, ILGA Europe, and Pan-Africa ILGA. And I work very closely with the different ILGAs and their leadership in coordinated fashion. And one thing that we've been witnessing, and I think, it's a general observation, right, is it's not just about prejudice, and it's not isolated or region specific, it's systemic coordination. Anti-right actors are transnational, narrative driven, and strategically aligned. They target gender justice and LGBTQI plus communities, but more and more, they're targeting all the rights, even, just gender equality, DEI, just things that were, not even that, I would say, taboo or controversial like 5 years ago. So we're seeing a solid backtrack, like a sort of a democratic rollback. And that same playbook repeats. No, it's we're seeing it in different places, the entry points or how these actors are trying to push. It starts with a criminalization or legal restrictions, moral panic around protection of children, moral panic around definition of family, attacks on body autonomy, a push for medical intervention on intersex children, and this not being seen as violence, but seen as corrective, weaponization of religion, digital disinformation. So this is like across the board, like the how the rollback functions, and gender nonconformity becomes the symbolic battlefield. So LGBTQIA plus communities, and particularly trans people, are framed as threat to nation, family, and culture, and as the scapegoat or the sacrificial symbolic identity to align all other identities into what is seen as right and conform, and a very Eurocentric definition of family being this nuclear definition of a male father, a female mother, two kids and a dog, which it does not equate the definition of family worldwide. We have like multiple pluralities of what family has looked like historically for people in the global majority. But this is the really the narrative that's been pushed, and it's weapon and in their weapons that are used, like funding restriction, registration barriers, and also the legal framework, criminalization, and white saviorism, right? We're seeing our societies globally as the battlefield between polarized battles of Western society playing in our backyard and affecting our skins. And also seriously, crucially, most fundamentally, economic precarity intersects with discrimination. Marginalized community are pushed out of housing, employment, healthcare, and legal systems simultaneously. So this is not really identity-based discrimination. It's governance restructuring through gender.
Thank you so much, Naike, for sharing the work that ILG is doing, and of course enlightening us on what the nature of the problem truly is when it comes to advocating for sexual reproductive health, especially among the LGBTQIA. We'll move on to Amaranta. Maranta, drawing from your work with trans and indigenous communities, could you share some of the specific challenges transgender people face when trying to access healthcare and legal protection in Latin America, especially challenges that outsiders often don't recognize?
Sí, muchas gracias. Creo que es importante.
Of course, thank you very much for the question. I think that it is important to point out that currently one of the political categories in Latin America and in the world is the trans category. And that is a very important category when we think about human rights and social justice fights in the transgender social sector. But I would like to mention that the trans category is important in terms of political categories as an umbrella that can include other identities like the ancestral gender identities like the Fafafines in the Polynesia, the Mushes in Mexico. So it's actually much wider, this recognition and acknowledgement of trans people around the world. I believe that there are many historical and contextual and current challenges. In terms of historical challenges, I would say that it seems that trans people are only acknowledged in two areas. So one is the work environment, because sometimes the options of life for a trans person is either sex work or to, or hair caring for someone in their hair. So these, of course, are two very respectable professions, but it's not the only option. The life expectancy of a trans person in Latin America is still 30 to 35 years old. We see people now going into their 50s or 60s because the um, numbers and the rates of violence for trans people in Brazil, Mexico, and Colombia is very high. These are the three countries that have the highest number of violence, highest rates of violence against trans people. So when we talk about development and social justice, we need to defend human rights of trans people as a fundamental piece. So these are two historical elements that I want to point out. But of course, many of the bodies of trans people, we have HIV as a very important problem because they don't have access to healthcare in the early stages. Also, trans communities that have been involved and that have participated in educating the public around these access challenges. Now, moving on to contextual challenges, I would say that family histories are at play here. When families identify a trans girl, they are, in many cases, ousted from their families, and they have to live in the streets. Also, they drop out from school very early. So even though being from an indigenous community that had their own world vision, when I was in secondary school, I had already adopted my feminine identity, and I was not allowed to continue my studies, which would mean dropping off. And I decided to continue my studies in the open system. But many other trans people in the world or in Latin America don't have that option. So this binary system does not allow for trans people to finish their studies in a timely fashion. So when we talk about certain cases like Argentina or other countries, even though these spaces are being offered for trans people, in many cases their technical and intellectual skills are not installed because they were not provided on time because the state refused it. The society and family excluded them in the very, very early stages of their identity. So these are part of the contextual challenges and stories that we continue to battle with in many, many ways. And of course, the young people that are undergoing very, very serious challenges around drug consumption, also linked to HIV as well. So, in many cases, they die abandoned. So, these are contexts that we are still not assuming. And we will not be able to reach millennium goals if we do not provide full rights to these communities. And I would just like to wrap up with the current challenge very quickly. Currently, we have an anti-feminism movement, and those movements that are creating discourses and narratives that question the right to exist as trans people. And that is a very big challenge that the United Nations should take on at the all levels of the political spectrum. And this is something that I believe we need to work much more on to find partners, to find allies, so that we can create a much more intersectional movement for all those rights to be acknowledged.
Thank you so much, gracias, Maranta, for sharing your thoughts on that. And what I'm hearing across all three of you is that these aren't isolated barriers; they're systemic patterns. Whether through law, funding structures, or social norms, the same exclusions reproduce themselves in different contexts. And as we come to a close to this panel, I'd like to invite my panelists for a brief 30 seconds to 1 minute as we close. I'd like to invite you to just, what in the next 5 years, what should we change to truly advance human rights and gender justice for marginalized communities? Moving forward, looking forward, I'll invite Naike to start us off in 30 seconds.
I will do it in 30 seconds. I can do it. Well, I think the first thing that I've started like really digging into is that we need to start funding. Funders need to catch up with us. And a lot of us has been saying this forever, but the funding landscape and funder responsibility needs to start seriously, because the competitive funding model has broken us too much, and this needs to stop. And a lot of social movements all through the different sectors, we are willing, able, and have always wanted to have funding models that are transparent and that are all about power sharing. So this needs to happen yesterday. And there needs to be the funding of infrastructure work. When I mean infrastructure work, I mean narrative power, security, sharing, like all the infrastructure. It needs to be stopped seeing as overhead, but as frontline work. We need to protect disruptive actors, because oppressive forces tends to reward the safest actors, and the safest actors usually do not push the justice agenda. We need to invest in narrative courage and experimentation and build cross-sector political alignment with intentionality, so that we can preserve victory memories, because we've won a lot, and not sink into depression and hopelessness. But it's time to pause, restructure, and demand more equitable funding models and more cross-sector collaboration.
Amazing, powerful call to action. Thank you so much for sharing. We'll move on to Nomtika in 30 seconds.
Oh, I do definitely, especially after Nike. That was fantastic. The first thing I had on my list is that we need to be sustained as a movement. We need to be resourced. And one of the things, just to add on what you started with, Nike, is we were also talking about how we're doing this power mapping exercise as we're working through the strategy. And one thing we came to the conclusion and agreement to is there's not a lot we can do to change anti-rights actors, especially given how resourced and how aggressive they are in how they are infiltrating the space. What we can do is to really challenge the donors and the people who are resourcing within our own movement, but also really challenge ourselves to be innovative in looking at what is this collective coordination and alignment looking like in the process. The other thing I would add to that is around design justice. I think it's a framework by Dr. Sasha Costanza-Chock, and it talks about communities have the solutions to their problems. And I think, again, Nike, you broke it down very nicely around the creation of infrastructures and making sure that when we talk about systems, when we talk about what the response is, nothing is considered overhead because all of it is fundamentally part of the frontline work. Let us not sleep on these human rights mechanisms. If we are not there, those anti-rights actors are there. One of the things I was hoping to raise today is the incredible work that with ILGA World and a lot of Geneva Partners coordination, Frontline Aid was a part of in the renewal process of the SOGI mandate. Those are not conversations and achievements to take for granted. That's the kind of resistance work. I come from South Africa. You know the comrades here, they're always ready to take things to the next step. And so that's just what I'm encouraging. Design justice, communities at the center. Really, the sustainability conversation in the next 5 years is important because we will also have to transition out of certain funding models. And then lastly, and more importantly, really counter-narrative action is important. So the messaging alignment as well as not taking these human rights mechanisms for granted. Thank you so much.
Thank you so much, Namteka, for that segment. We'll finally move on to Amaranta. 30 seconds.
Qué difícil cerrar.
It's so hard to wrap up after Nike and after Namtika. But of course, I just want to add my voice to the funding problem. My one concern is the following. If we still think that the North philanthropy will continue to fund us, is that what we want? Or should we think about restructuring the types of funding that we want? We need to and want to diversify. We need to think about South sourced funding. And I think that that is a urgent task. We need to stop our dependence on the North because the North is in a crisis, and we need to take into account that. So just to add to that point as well, I wouldn't think about this in a 5-year time frame. I would say a little bit longer term. I would say 20 years, because there is a fundamental element that we need to work towards in the next 2 decades is to build intersectionality, but not only in the descriptive sense, not only when you say that a person is living 3 different types of realities. Maybe she is migrant, black, and lesbian. It is not only a matter of describing things or people. Now we need those stated realities to start in collaboration. What does the LGBTI movement has to do with the agricultural movement in China, or the mining movement in Chile, or with the youth movement in Brazil? It has a lot to do. So we need to talk with other actors that are not part of our daily activities. We need to break away from our niches where we are just speaking to the choir. So we need to get out of our niches and bring other agendas with us. That is what's called a collaborative intersectionality. It's not a blank check. It's rather the possibility for the other to stop seeing themselves or seeing us as the source of all evil. We need that collaborative intersectionality model in 20 years so that we can find other actors that are not in our radar at the time.
Thank you so much, Amaranta, and thank you so much to our panelists who have shared amazing insights. And today's conversation reminds us that social justice is not an abstract principle. It lives in policies that protect or punish, and in whether communities truly hold power or only stories. SRHR becomes real only when dignity becomes non-negotiable, and that was definitely emphasized when Clara set the stage, and of course our panelists have shared with us today. So thank you so much for your amazing insights and for the amazing conversation that we've had today. We'll move on to our next session, which is interactive. Thank you so much.
Thank you so much, Cinnamon. And I'll be taking it from your panel, from your wonderful panel. Just a quick request to all the participants that will be taking a few more minutes to make sure we cover the last session, which was an interactive dialogue, because we want to hear from you all. We've heard from the speakers, but we want to hear from all the participants. As our panelists were talking, I was also monitoring the chat box, and I saw a comment from Florence, from Liz, from Namkwaya, and most of the comments were around the challenges that are facing our work today, and in terms of the challenges that are limiting our efforts to make sure that we are getting to a world with social justice. Now, I had 6 questions to moderate in an interactive dialogue, and I would really love someone, 1 or 2, to open up their mic and share openly. Instead, maybe of looking on all 6 questions, we can pick a few from these. But my questions were really focusing to learn about the challenges that we face in advancing human rights and gender justice, but also looking on the opportunities that we can actually leverage to make sure that we are advancing gender justice and human rights. And then partnerships. And what are the barriers to these partnerships? And if we have any successful stories of a successful social justice movement moving forward that we can learn from. So if anyone wants to open their mic very briefly and share any and respond to any of the questions that I've asked. If you want to talk about the challenges, which is, as I mentioned, I saw it in the chat, people are sharing the challenges, especially stigma towards people with disabilities. We also heard from the panelists about the funding models that are operating now, which are really hindering our work. But also it would be great to hear about the opportunities. What are the opportunities that we could tap on to move this work forward? Do we see any partnerships evolving? What are the barriers to these partnerships? And if we have any successful stories. So anyone in the audience, feel free to raise your hand and I'll give you the mic to share your response. Anyone in the audience? And I see my colleague Goodness pasting the questions in Spanish and French. Thanks, Goodness, for that. Anyone who would like to share their response to these questions or share a successful story of a successful social justice movement, or talk about the challenges that are happening within their own communities for a minute. Okay, I don't see any hand. Goodness, do you see any hand from your side? If not, yeah, as we're waiting for anyone to respond to that question, to these questions, maybe we can also talk about the commitments. Would be very great to hear some of the commitments that we all can do to advance social justice in our own communities. I saw from the comments, again, I really like the comment from Namukwaya when the speakers were talking. Namukwaya shared about the challenge that is happening in the rural side of Uganda. But at the end, Namukwaya wrote a comment saying, we all need to show love, kindness, and support in our own community. That's like a way forward, and that's like a commitment that Namukwaya was making. So anyone who would love to share their commitment towards advancing social justice in our own communities, what are you committing to do? And could be really little actions that can be done within our own organizations or within our own communities. Any commitment? And thank you, Goodness, for pasting all the questions in the chat. anyone? I want to call some names, but I don't know if you all be comfortable. Juan, I really want to hear your voice as well. Are you going to make any commitments towards advancing social justice in our own communities? Or if you want to share any successful stories? Yep. Juan, please take the mic. I think you can talk now, Juan.
Can you hear me?
There you go. Yep, we can hear you.
Oh my God, on the spot.
Sorry.
No worries. I was just thinking like on the different questions and also thinking about some discussions that have been held regarding what the speakers were talking about in terms of changing the funding kind of framework or like the usual strategy, like how we can go beyond projects and how we can scale this funding model that kind of community-based organizations have been using so far in the current scenario. And so I think to scale, I've also heard about domestic funding, as Amaranta was saying. How can we support each other in our own regions? So I was thinking about how we can also kind of think about there's I don't know the translation for it. It's called like economía solidaria in Spanish, like solidarity economy, um, in terms of how we can collaborate. So those were kind of my thoughts. And regarding the challenges, if you ask me personally, it's been a kind of interesting because sometimes, as also Amaranta said, I agreed with a lot of points. Sometimes we end up speaking among us, like within our own circles. Whenever I face even daily life scenarios, being an activist, I am like I face discrimination or power relationships. And sometimes when it's not a political scenario, when it's on a daily basis, like something that seems normal, that's a challenge for me, like personally. And so I wonder how we can also support each other collectively as people that works on the human rights field. So I think that could be a big challenge as well, like how to face those kind of scenarios. But I think those would be like my main thoughts as of now, as part of the also youth. Um, well, in maybe just a last thought regarding youth, I think this intersectional approach, how we can also relate with, or how we can also face other kind of situations. Like, for example, today we're on a work or labor rights manifestation here in Colombia. So, in how that affects different, like on a differential way to different sectors, I think a lot of to think about. So I think those would be my three ideas as of now. I hope it was clear.
Yeah. Thank you. Thank you so much, Juan, for sharing that and emphasizing us on the intersectional approach towards, strengthening our efforts in advancing social justice in our own communities. Now, I know we're behind time already. I really wanted to hear from at least one or two people from the session. Maybe we can move on to the commitments, and my colleague Amarachi will paste a link in the chat for us all to share our commitments. What are we going to do? Is little steps that we can do to advance social justice today in our communities. We heard from the panelists on what are they going to do, but also be really, really great to hear from you all. What commitments are we making? Amarachi, is the link for this Mentimeter in the chat? If you can paste it in the chat as well, would be great.
Yes. What part of my screen are you seeing, please?
We can see what actions are you committing today, but there is no link to the Mentimeter, so we can't see. Or you mean people can just log into the Mentimeter and then put that code?
I'm going to put that in the chat box.
Oh yeah. Yeah, so if we all can do one commitment that we're going to commit and do in our communities to advance social justice, please open the link in the chat and use the codes on the screen and share your commitments. I'm going to say I did write down some of the ideas or some of the little stuff that we could all do to advance in social justice today in our communities. You can do it by telling your own story, as Clara did during the opening up of this session. You can do it by writing a commentary on a magazine within your own country, home country, like writing a response to something. You can post on your social media about, what should be done to advance social justice in our own communities. You can initiate a dialogue with your family or friend and talk about these issues and educate where you think people need more knowledge. You can write a blog at your organization. You can donate to a social justice movement. You can, strengthen your organizational policy. You can commit to learn about social justice history and what's happening in our communities today. You can mobilize in your own community. And at the end of the day, also, you can walk the talk. Make sure you do what we're actually preaching. So these are some of my ideas that we are coming about, some little steps that we could do to advance social justice in our own communities. But please feel free to share as many ideas as possible in the chat using the Mentimeter link so as we can learn about these commitments. And I can see response coming from the
Yeah.
Yep. You can see continue to cause havoc where needed, convene more with these phenomenal people and develop strategic plans with the limited resources, dismantle power and be fabulous while doing it. Amazing. Thank you for the response. Would be great to see more commitments. Please take time to think about what you can actually do. Could be at your school, at your community. I will share the main message from this webinar with the colleagues and students in my universities. Kudos. Thank you for that. You can see more. I will encourage community leaders to speak up, mothers, faith leaders, and other amazing allies. Exactly, that's what we should be doing. Thank you. And then Choir shares in the chat saying they'll continue promoting sexual and reproductive health and rights in schools with disability inclusive. Super. Great. Integrating self-care on our leadership. Amazing. I'm loving all these commitments that are coming. So please, everyone, make sure you share your commitments on what are you going to do in your own communities. And maybe when people are sharing their commitments, I would love to just take a minute to promote for people who still want to engage with the Power Shifting Subcommittee. There's going to be more webinars like this where we talk about how do we push for power shifting efforts in the work that we do. So there is a link in the chat that my colleague Amarachi pasted. Make sure you click that link and you can be part of the community of practice on power shifting or shifting power in sexual and reproductive health and rights overall. See more commitments coming, shift from tights-only framing to shared values, safety, family protection, economic participation. Values can open the space. Here. Reflect on my own personality. I love this one. Committing to just reflect on our own personalities as well. How my role affects my approach on sexual and reproductive health and rights advocacy. Local storytelling over abstract policy debates. Love this one. It really matters. Good to see more commitments coming. And just reminding you all, the other commitment you could do is joining the Power Shifting Committee of Practice, the ICFP Power Shifting Committee of Practice, and keep engaging these conversations moving forward. More commitments. And I think at this moment you could really agree we are maybe a little bit over time. Goodness, do you want to take a minute just to say something else, and you all can keep sharing your commitments in the chat or through the Mentimeter. Goodness. Or is waiting for Goodness to say bye. There is another question on the Mentimeter on what primary area will you focus your efforts on?
Hi, Innocent. We are walking through the rest of the
there you are.
poll. Yeah, I've been
Okay.
here. I thought you were still going through the poll, but
Oh,
as
okay.
people
I
are
was.
responding.
Okay.
Do you want me
Go
to
on.
take over from here?
Go on, Goodness. Sorry, I was just worried about the
Okay.
time, so I
So it's
wanted you to
okay.
say
Yeah,
something.
I'm also concerned with the time. Everyone, thank you so much for staying until this time. We did not plan to go beyond the scheduled 1 hour, but we had some tech glitches and also our panel discussion. We needed to give some depth to it. But please feel free to go through the comment section to see the translation of the questions on your screen in French and Spanish. And would love to get your response to these questions. Still on the Menti poll as quickly as possible. Innocent and Amarachi had also shared the link to join the Committee of Practice on Shifting Power in SRHR. This is our own way to continue to advance this discussion and build momentum. So feel free to join the Committee of Practice through the link. And it's also a platform for cross-collaboration as well. We've not gotten any response for this question yet. I'm wondering if we want to move to the next just to save us time. Okay, happy to. So part of what we hope to do through this webinar, just as you are responding, is we have been able to compile some valuable resources to support the work that is being done when it comes to SRHR and social justice movement. And we believe that this resource would be valuable to the work that you do. So we would be sharing that in the comment section for your reference. Feel free to go through them, but even if you miss the link in the comment section, you can always have access to it on the Power Shifting web page. So I'll be posting that in the comment section in a few.
Thank you, Goodness. And just emphasizing the question on the Menti. Oh, go on. Sorry.
Yeah. No, I can see that we've moved to the next question, but I'm not sure if Amarachi has received any response to it yet.
No responses.
Yeah, I think it's good.
Responses will show on the screen once they come in.
Yeah, I thought as much. Okay, that's fine. So I will just share the resource that could be valuable to all of us beyond this session. So the first resource which we have shared is on Making sense of the now. This is a guide on collective reflection in times of transformation, and it is from the Time Initiative, which is Humantum. So feel free to take a look at that and see how applicable it is to the work that you do. We hope that this is not just another session where we talk, but also we can be able to make meaningful action in that regard. I will be sharing it in French and in Spanish as well for our reference. But like I said, after the webinar, we are happy to, we've already publicized this resource on the ICFP Power Shifting webpage, which we will be sharing the link to that for you to access and make use of. So feel free. I can see some response in Spanish, I guess. So the second resource is on understanding the language we use. This gives us insight to some core concept that helps us to use the right language, understand the context of this language, and not impact more social injustice in what we do. In the comment section, Amarachi has also provided the code to the Menti poll if you want to provide more response to us. But happy to work on those simultaneously. Thank you. So I have shared the link to the resource in Spanish if you want to take a look at it. I'll also be sharing it in French now, the two major resources. But if you go to the ICFP Power Shifting webpage, you will definitely find other valuable resources that speaks to power shifting, decolonization, and past webinars that we have carried out, which we believe would be valuable to you and the work that you do. Okay, so I think I have just shared the resources in Spanish and also in French for your reference. Let me share the second one in French. So I believe that some of these resources are already, some of them are in French, but not all of them are in like both languages. This is also an area of growth that we hope that the organizations get to translate them. So please bear with us if you don't have access to the main document in French or Spanish. Thank you so much for staying until this time. We deeply appreciate your support. I'll be posting the link to the ICFP Power Shifting webpage, which we encourage you to go to, and you can always get more information and resources, and even the ones I've shared on it. I see that we've gotten some response on how we would engage your organization and community in the next 30 days. Somebody saying they would identify and distribute practical resources that support SRHR advocacy. Brilliant. And we'd love to hear from you how that goes. So it would be a valuable learning opportunity to see how this is practicalized. So yeah, we look forward to seeing the impactful work and hearing from you. Another person is saying she's going to be doing some project management, which is brilliant. Thank you so much for committing to investing in this work and pushing ahead on advancing social justice. We'll be wrapping up the session in a few minutes. I see that many of us who have been here from the beginning are still here. We deeply appreciate you staying on. I can see a response on support. You need to take action, funding, support, networks, educational spaces, skill building. Absolutely. I absolutely agree with the need for this support, and it's important. I'll have to translate that, but thank you for sharing. Okay, so I think at this junction, we are happy to wrap up today's webinar. It's been a very reflective and stirring discussion. Thanks to all our speakers, our moderators, and the very engaging audience we've had. Thank you for being part of this discussion. Thank you for contributing to this. As we had earlier announced, tomorrow is the date that the United Nations has set aside, 20th of February, for the World Social Justice Day. However, this is a timely discussion that sets the pace for all the activities and convenings that would build into the World Social Justice Day. I want to believe that in your respective corners, your work, and what you represent, you will continue to take actions. You continue to challenge the status quo. You continue to make the systems that oppress and pull others down to be uncomfortable until we have a more just, equitable, and peaceful world and fairer world for all. Once again, thank you. The recordings of today's session will be publicized on the ICFP Power Shifting webpage in the coming days. Please be on the lookout. Feel free to shoot us an email if you have any questions or have some feedback for us based on today's webinar, or if you also have some actions you've taken that you would love to share your success stories. ICFP is excited to publicize the success story that comes out of the work you are doing and how these discussions have in some way contributed to that. You have a wonderful rest of your day. And thanks again to everyone who has contributed to making this a success.
Thank you,
Bye.
Goodness.
Thank you,
Bye.
Dostani.